let's chat about this video from Sovereign Parenting. So I've been tagging this video because it talks about refusing an IV in the hospital when giving birth. Because even if it's hospital policy, you can still refuse. And the answer is you can refuse anything in the hospital. We cannot make you do anything, hospital policy or no hospital policy. All we have to document is that you refused what we recommended, period. Then that obviously lends itself to the next question. Why are you going into the hospital then? There's no question that hospital births are associated with more interventions. They are, when compared to a home birth or a birth center birth. Those interventions can include placing an IV, fetal monitoring, starting Pitocin, having an induction of labor, all of those things associated with delivery. But it also includes interventions such as getting a blood transfusion if you hemorrhage, getting antibiotics if you develop chorioamnionitis, getting neonatal resuscitation if your neonate needs it, having access to the NICU, having access to a higher level of care should you need it. And regardless whether or not people want to acknowledge this, including Sovereign Parenting, low-risk births can turn high risk in a matter of seconds. I've been doing this for 22 years, and I've seen it happen a lot. So first, if you are someone who already knows you don't want interventions, and you know what interventions you don't want, and you know what it means to decline interventions, start having those conversations with your obstetrical care provider or midwife or whoever it may be sooner than later so they know what you're expecting and what you do and do not want during your birthing process. Having realistic expectations of what a hospital birth is going to be like or might be like is key. But I also want to make this very clear. There are a lot of people, low-risk pregnancies even, who want a hospital birth because of the interventions that we offer and because of the interventions we can provide if things go wrong, whether it be with the neonate or the person delivering the neonate. And there is absolutely nothing wrong with that. There are so many accounts telling you what you shouldn't do, or that you can refuse this, you can refuse that, your autonomy is being taken away, and this and that. And I get that because a lot of people's autonomy has been taken away. But that doesn't mean that's what you need. You have to decide for yourself. So if you want a hospital birth because you want to have access to those interventions should you need them, that is perfectly fine too. To my knowledge, and I've looked, Sovereign Parenting has no medical credentials whatsoever. So what they should be doing is talking about what they did for themselves and not making any medical recommendations for anyone else. So remember, all these things that accounts like this are telling you not to do or refuse, they're also putting in their bio or somewhere that they're not giving you medical advice. If any account is telling you something to do that is different than what is indicated or recommended or standard of care, that is still medical advice, in my opinion.